My name is James. This is Clara. We're going to take you to the cath lab today.
Okay, here we go.
Cardiac catheterization is considered the gold standard of investigating patients' coronary arteries. So basically it would tell us whether somebody has any type of blockages in their arteries. Now we have other non-invasive tests which involves stress test and imaging techniques, but still the best resolution comes from cardiac catheterization.
The catheterization lab is really a central part of advanced cardiovascular care, and up until now we haven't had the opportunity to provide that service.
Now we're able to diagnose life-threatening problems, but we're also able to treat those same problems and the same hospitalization at the same time, almost immediately. These types of features allow us to provide a type of care that was, again, never available, but also at a level that is superior to other locations in this area. Prince William Hospital, like other tertiary care centers both in Northern Virginia and in the District of Columbia, can now provide cardiovascular care that is not only life-saving, but also improving in terms of its quality of life to our patients.
Did the doctor explain why you're here today? Okay, we're going to do a cardiac catheterization. Now what we're going to do next is we're going to actually put a hard board underneath you, and then we're going to slide you onto our table, okay?
The patient is laid on a table, and we put a flexible latex tube or a catheter into the patient's artery, sometimes in the arm, sometimes in the leg. And through that catheter we thread thinner catheters up to the arteries of the heart, and we're able to inject dye or contrast down into the arteries that allows us to visualize the blood flow through those arteries, with the idea that if there's a blockage there, we'll be able to identify that and then move towards fixing it.
If we do find significant blockages, there are a couple of options. Sometimes we can fix things with balloons or stents, and sometimes we will send patients to bypass surgery.
This procedure is done under conscious sedation, which means patients are sedated, and we also use local anesthesia. So patients should be very comfortable during this procedure. And often I've had patients who ask, when are you going to start the procedure, although we are already done with the procedures and they haven't had any sensation of the catheters in their arteries.
The future of cardiac care really begins with the cath lab. Many of the other services have been offered up to this point, but this just really broadens what we're able to offer to the people of this area.
Catheterization at Prince William Hospital would open the door for future procedures in this hospital. So initially this is a diagnostic cath lab where we're going to be able to offer imaging and taking pictures of these arteries, and be able to, next step, to be able to offer coronary angioplasty and using balloon or a stent to open these clogged arteries, and eventually be able to offer this for patients who present here with the acute heart attack and be able to open the arteries that are causing these heart attacks.
Prince William Hospital is in a unique position, both geographically and based on its ability to provide optimal cardiovascular care. It is unique in the sense there's a significant amount of heart disease in this area. We're able to provide, again, a high level of care to patients really at need. These patients generally come from all walks of life, all different demographics, and have a wide variety of heart rhythm disorders. The electrophysiology studies that we perform, the catheter ablations and heart catheterizations, are all done to help these patients go on living their active, normal lifestyles.
We're very pleased to be able to offer this here in Prince William County.